Next on the agenda is our two great colleagues, Amy Palat-Potter and Kathy Paulson. They're our nurse practitioners in the Center for Sarcoma and Bone Oncology. They're going to discuss myths associated with GIST and non-GIST sarcomas.
Okay, everyone. So I'm Kathleen Poulsen, and this is Amy Palat. We're the two NPs in the sarcoma group. Some familiar faces for, I think, each of us. Thanks for coming. We did this Mythbusters presentation last year, and we're asked to come back and do a repeat performance. So this may be review for some who were here last year in part, but there are some new slides. We strongly encourage audience participation. We want you to shout out your answers, and we're open to questions, but we've been told there's a little bit of a time crunch up against the lunch break. So we can answer some during the presentation, and Amy and I will both be available during lunch immediately following and happy to answer any questions. Okay, so the practice slide is, a new treatment was just approved by the FDA for the treatment of soft tissue sarcoma. What do you think? Fact or fiction? Anyone? True, exactly. So pazopanib, also called Votrient, was just approved for soft tissue sarcoma in patients who have been previously treated with chemotherapy, which is great news for sarcoma treatment. All right, so let's get started. So I'm on anti-cancer therapy, so I should be nauseated. What do you think? Well, correct. Some of these are very obvious. I apologize for that. So some of our patients are on once daily oral medications, and sometimes simply shifting the time of day from morning to evening or evening to morning can make a big difference. We recommend eating smaller, more frequent meals over the course of the day and trying to avoid what tend to be more nausea-inducing foods such as greasy or high-fat foods, and caffeinated or carbonated beverages can also be problematic. Our great team of nutritionists here at the Farber strongly recommend sipping on clear fluids such as ginger tea or lemonade frequently throughout the course of the day to help prevent dehydration. Typical scents such as ginger, lemon, lavender, or peppermint included in your foods or drinks or even in lotions or aromatherapy can also be helpful. And talk to your team. Adding anti-nausea medications can be very helpful either before you take your medicine or sometime during the day. We also have a great team of nutritionists as well as the Zakim Center where they offer massage and acupuncture, Reiki therapy, which can also be beneficial for nausea. Diarrhea and constipation. So normal to have diarrhea 8 or more times per day, and if I go 3 days without moving my bowels, I shouldn't be worried. Of course. So diarrhea and constipation are very common side effects for our patients, sometimes even both in the same day for a number of patients. So for diarrhea, we recommend, for diet, we recommend eating small meals throughout the day or snacks that are bland and low in fat. BRAT diet stands for banana, rice, applesauce, and toast can be effective. Drinking plenty of fluids that have natural salts in them, such as broths and diluted juices, can be helpful. And to drink fluids between meals as opposed to at meals, and include, again, drinks that have salts in them, such as sports drinks and teas. Limit milk and dairy containing beverages, and our nutrition team also tells us to avoid very hot or very cold foods and drinks. For constipation, high fiber, focusing on whole grains, oatmeal, beans, fresh or frozen fruits and vegetables, warm prune juice or tea, which can be very beneficial, and again, drinking plenty of fluids. Talk to your team about a bowel regimen. We have lots of tricks up our sleeves, and also nutrition can be very helpful here as well. A bar of soap between the sheets at the bottom of the bed cures leg cramps. What do you think? Yeah. We say fiction, although to be truthful, I have had some patients say it makes a difference, so maybe some placebo effect there, we'll see. Calcium and magnesium supplementation can be helpful. Increased hydration is definitely helpful, as can be gentle stretching exercises during the day. Okay, for fluid retention, Easter dinner with ham, hot dogs, bacon, and V8 didn't contribute to fluid retention. I'll lose weight while I'm on anti-cancer therapy, and Preparation H can improve my puffy eye. Okay, yeah, pretty obvious, right? Okay. So definitely don't put preparation H around your eyes. It's not advised. Minimize the salt in your diet. Read your labels. Very deceiving. There's often more sodium located in foods than you would normally be sure of. And high salt-containing foods are also smoked or processed meats, TV dinners, etc. Try sleeping with your head slightly elevated, either with a bed mildly inclined or with a couple of pillows, and don't expect to lose weight on treatment. It's actually not that common. Pigment changes. So my hair is turning white because I am getting old quickly, and sunblock is not necessary given the Northeast. Okay. So some treatments, particularly sunitinib and pazopanib, can make your hair turn white. It will turn back to normal when you're off therapy. Some of our treatments also actually make you lose your hair, and if you're losing a lot of hair, you should speak to your team, because through your insurance you can be eligible for a hair prosthesis or wig. Sunscreen is recommended for everybody, and some of the treatments that we give, both IV chemotherapies and oral medications, can make you more sensitive to the sun and likely to burn. This is actually a picture here that Dr. Wagner shared with us to show you that how in picture A, that's before treatment, picture B is after being on therapy. And then these last ones show you while the patient's actually on therapy. At the root, the hair is white, but it's black at the tip. And E shows you where the patient started sunitinib therapy, where they were on it for 4 weeks, and it turned white, and then went back to normal in the 2 weeks that they were in the washout, and then back to white as they restarted therapy. Okay, so Amy's going to take over here.
Thank you, Kathy, and thank you for inviting us again to talk. We really love doing this, and I wish we had a lot more time, because a lot of these topics we could devote a half hour to on their own. But again, we encourage participation, so if you have any questions, please ask us. So oral toxicities are very common with GIST-related therapies and also non-GIST-related therapies for sarcoma and other cancers as well. So fact or fiction on these topics here. Alcohol-based mouthwash, such as Listerine, can help soothe my mouth sores or my mouth pain. A white, thick coating on my tongue is normal. I should not expect taste changes with treatment, and it's good to add extra Tabasco to my nacho chips. Fact or fiction? Very good. All right. So we recommend, generally speaking, that if you're having some oral toxicities, that you avoid certain foods such as very salty foods, sharp foods like potato chips, Stacy's pita chips are really firm, baguettes, things like that. Minty toothpaste can be really can cause a lot of pain, so we recommend that you use gentle toothpaste like Sensodyne or Tom's of Maine. Even Barbie and Spider-Man toothpaste can be much better for you. Carbonated beverages can cause pain, and certainly hot and spicy foods can trigger some pain. We recommend that you use a soft toothbrush, so for standard chemotherapies and even some of the GIST therapies, your platelet count can drop, so you can find some irritation of your gums or some bleeding. And also, if you just have some pain, a soft toothbrush is an easy way to soothe that or not make it worse. Talk to us about your mouth sores. You may find during your examinations that we're looking at your mouth every time we see you. Some cancer therapies cause different types of mouth sores. Some can resemble canker sores and have a whole different way of treatment versus some of the GIST therapies or regular chemotherapies. So we really encourage you to talk to us about your mouth issues. We're very lucky we have colleagues at the Brigham Dental Group that see our patients who have some complicated cases of mouth issues. So we often refer if we need to. And lots of times we need to prescribe medications, whether it's a mouth rinse or sometimes we even use steroid rinses for certain cases, so please do talk to us. So hand-foot syndrome. There is nothing to be done to help the pain in my hands and my feet associated with my therapies. Fact or fiction? Thank you. Fiction. Some of you may be very familiar with your hands and your feet looking a little bit like this. This is a more severe case of a hand-foot skin reaction associated with some of the tyrosine kinase inhibitors like Sutent or sorafenib. Pazopanib, regorafenib, other drugs that we use can cause these side effects where people tend to have some callousing and pain in their feet and their hands associated mostly with the pressure points, but also can be anywhere on the feet. Can cause a lot of pain and really limit your activity. So we will prescribe different soothing ointments and sometimes prescription medications to help with this. You can also get a different type of hand-foot skin reaction with standard chemotherapies given for sarcoma and other cancers. And this is a typical hand-foot skin reaction with the chemotherapy called liposomal doxorubicin that we use quite frequently. and it's more like a burning, peeling sensation, can cause a lot of pain and discomfort as well. So what do? We recommend when we start these medications like Sutent or Regorafenib for people that you start moisturizing right away. So apply good moisturizers, thick emollient creams liberally, like nothing fancy, no fragrances. I'm talking bag balm, udder cream, really not fancy things that you can get over the counter in the pharmacy. If you're having trouble, it's good if you put these ointments on liberally, put socks over your hands or mittens and also your feet and wear them to bed so the absorption is better. Try urea-based creams like Eucerin with urea. Some people think that can be helpful. Certainly wear comfortable, well-fitting shoes. Sometimes gel pads can be helpful. If you're wearing heels or different kinds of sandals, it can definitely irritate the pain. Avoid or minimize the offending activities. This isn't possible for everybody. If you're an electrician or a plumber and you're working with your hands all day, this is hard, but you may find that you can alter your activities. So if you're a runner and you need to switch to the elliptical machine or something so there's less impact, that can be helpful. And then talk to us. We want to look at your feet. We want to look at your hands and make suggestions to help you. Some of the medications we'll prescribe will be prescription. Okay, pain. We talk a lot about pain in the walls of the Dana-Farber. So if I take narcotics prescribed to me for pain, I will become addicted, so I should not take my pain medicine. Constipation related to pain medicine will improve over time, and my pain will get better if I just simply ignore it. Fact or fiction? Yes, thank you. All right, pain management facts. Again, we could talk all day about pain management. We will help you to find the right dose of medication and the right medication for you. It may be narcotic, it may not be narcotic, but we want to talk about this. We don't want you to live in pain. This is something that we can absolutely treat. It is true that you can absolutely build up a tolerance to different pain medications, and we should talk for a second about addiction. It's very, very common where our patients come in and say, no, I do not want to take oxycodone. I don't want to take narcotics. I don't want to get addicted. If you're taking medications for the reasons they're prescribed, you're not at risk for addiction. You're taking it appropriately. If you're taking it for fun, that's a different story, and certainly that those patients can be at risk or people can be at risk for addiction, but not in the setting of taking it as prescribed. The narcotic-related fatigue, so certainly a common side effect with the pain medications is sedation or fatigue. That tends to get better over time. If it's not getting better, then we need to modify your dose or talk about other ways to manage that. The constipation side effect is constant, so pretty much while people are taking narcotics, they need to be on a bowel regimen, and that's something that we'll talk about with you. There's maybe non-medicinal ways to help with your pain. So sometimes people think acupuncture is helpful, massage, different types of meditation and things like that that we can talk about with you. Very commonly, we partner with our pain and palliative care specialists, whether it's here at Dana-Farber or at the Brigham where they have an anesthesia team. Sometimes it's a nerve block, for example, that's appropriate for you. So don't be alarmed if we're bringing in our expert colleagues to help us treat your pain. And there's a great handbook on the Dana-Farber website called Coping with Cancer Pain. Strictly, it's written for patients, so I encourage you, if you're interested in that, to look at that handbook online. Okay, so patients who are getting more standard chemotherapies are often given a growth factor to help support their white blood cells called Neupogen or Neulasta. This medication can sometimes cause some bone pain that can be quite severe. So the question is, there is nothing that can be done to help my bone-related pain from Neupogen or Neulasta. Anybody? Thank you. I should have put some facts in here. All right. Another thing we want to talk to you about, so I can't tell you why this is true, but some of our patients think that the allergy medicine Claritin or Loratadine is the generic name, can be helpful for preventing or treating the bone pain related to Neulasta particularly. And people say if you take it a half hour before the injection, it can be helpful. It really can't hurt much, so it's worth a try. There may be some prescription and non-prescription medications like non-steroidal anti-inflammatories that may be helpful. And talk to us. Sometimes we can adjust your medications. If, for example, if we give you one injection of Neupogen, you have a lot of bone pain, maybe next time we'll try Neupogen instead, which requires self-injection, but we can alter the dosing a little bit on that. All right. We've done this for a couple years, and we've been lucky in the past to have our Dana-Farber nutritionists come and talk, and they're not here today, but it tends to be a topic that people have a lot of interest about. So I have a couple slides here, and while you're getting extra hungry, let's talk about food. So organic foods are proven to prevent cancer. I can eat whatever I want because I have cancer, and my team is too busy to talk to me about nutrition. Facts or fiction? Thank you. Fiction. All right. This is we have again, I encourage you to go to the Dana-Farber website, and if you just type in nutrition, there's a ton of information, and this is taken directly from that site. This is what we want your plate to look like. So this is the optimal diet for cancer patients and survivors, and also for cancer prevention as well. Emphasizes mainly half your plate should be filled with fruits and vegetables, and then the whole grains and proteins should take up a quarter each. Fruits and vegetables, we really recommend 5 to 10 servings per day. This can also help with if you're suffering from constipation. They are loaded with what's called phytonutrients, which are natural compounds found in plant-based foods. And this is essentially the plant's immune system, and it may offer some protection in many ways if you're sticking to this sort of diet. Can act as antioxidants, boost immunity, anti-inflammatory pathways, a number of reasons that fruits and vegetables are good as the primary source of nutrition in your diet. Whole grains are very important. We could talk about this for a while, but really to focus on eating 25 to 35 grams of fiber per day, and sort of easy way to do that is to switch from white products like white flour, white rice to brown whole wheat pasta, whole grain crackers, whole wheat breads. So that's a good way to get into your whole grains. We suggest eating the skin of your potatoes and your fruit, because a lot of the nutrients in whole grains are located there. And then read your labels. If you look at the labels of a lot of foods you eat, I bet you'll see that there are a lot of ingredients that you may not want to eat in your diet. So we want you to look for at least 5 grams of fiber per serving on the food label. That also certainly can help with your GI side effects of your cancer or therapies. Protein, very important. It's necessary for the growth and repair of all cells in your body. So if you have an upcoming surgery, the surgeon may talk to you. If you have lower protein levels, we need to find a way to get your protein levels up. In terms of just getting this into your diet, fish, poultry, lean red meats, Greek yogurts have lots of great protein, and certainly nuts and beans are great too. Okay, some of our patients have problem with lack of appetite. We really emphasize eating small, frequent meals a day. There are different ways to add calories to your food. I won't go into this in the interest of time, but do look at the website where it has lots of good suggestions. Social eating is great. In this country and many countries, we really focus on getting together as a family, and it's a big focus of our social ways. And eat together if you're feeling good. Eat with your family. It's sort of a good way to help your appetite if you're not feeling so great. Tips for weight loss. So it's not uncommon for us to have a patient that comes in and says, this really stinks, I don't want to have to get chemotherapy, but at least I'll lose weight, right? Not necessarily. It's common for some people to gain weight while they're getting therapy. You can be less active, you can be exercising less because you may not be feeling as well. So sometimes our patients come in and talk to us about weight loss. It's great to, in any setting, to balance calorie intake with output, and if you can do a combination of cutting the calories in your diet and exercising more. Exercise is great at treating sometimes depression, sometimes fatigue. Certainly is a good way to lose weight and help you cope with what's going on. Smaller portions and smarter choices, so read your labels. Weight gain, also small frequent meals, adding good oils to your meals. So if you stir fry with good oils, if you put oils on salad dressings, on your salads, that can be helpful. Nut butters like peanut butter and cashew butter on whole grains can be helpful. And then it's great to be hydrated. We want you to be nice and hydrated, but it doesn't have to be just water. So if you're having trouble with your appetite, you can certainly get in some of your calories just with fluids. So smoothies, 100% fruit juice, whole milk products if you can tolerate dairy. And last but not least, we get a lot of questions about vitamins and supplements, and we very commonly partner with our dietitians to answer these questions, and we want to talk to you about this. So there could potentially be some negative aspects of taking these different types of vitamins and supplements that can alter the levels of the drugs that we prescribe, whether it's chemotherapy, oral therapies, or radiation potentially, and we want to know what you're taking, so we encourage you to talk to us about this. There may be some potential safety concerns, so it's something that we do need to know. And like I said, we often partner with our nutrition colleagues, and I really encourage people who are interested in this in getting a referral at the Zakim Center for Integrative Therapies, where they have what we talked about, the nutritionists and meditation and acupuncture, but they also have a physician there who specializes in this area, and he does great thorough assessments. So that is everything, and if you have any questions, We can answer them here, or if we want to break for lunch, Kathy and I will be around. And here's a happy picture of our families. Kathy's family is on the left, and my little one's on the right. Thank you.
Okay, maybe one question for interest of time.
Patients tell me all the time that they've been told not to have sugar because that feeds their cancer. Can you comment on that?
I would say, Dr. Dadama, what do you think? No, I would say it really doesn't add any, moderation. It really doesn't add any nutrition. It adds calories without adding good nutrition. So, moderation. I don't want people to starve. If they want a muffin, if they want an ice cream cone, that's fine. But moderation is what I would typically tell people. We do get asked that a lot. I agree.
I think, one more question, sorry.
It's actually not a question. I think that I wanted to make just a suggestion. Most of us that take Gleevec, we have a tendency to get edema. And when that happens, actually we have a problem with our shortness of breath. I want to caution many patients that take Gleevec. I'm on 600 milligrams, and the only reason I'm saying that is because my background of being a cardiac tech for 26 years. A lot of times people don't realize it, and they need to get in contact with their doctors, because if the edema, it's not just the puffiness always on around your eyes, but if edema becomes a little bit more than just that, I think they need to speak to their oncologist because of two reasons. Number one, it could be a serious case where it ends up being actually a CHF, for instance, which is cardiac congestive heart failure. The other one also, sometimes people could have pulmonary edema as well, and I realize it. So I think that is very important for them to not treat themselves or to think that they could handle it, but to actually make the call and talk to the doctor as far as being very fatigued from Gleevec. A lot of times I actually, and I do it myself, a lot of time I've suggested to patients that actually have taken, for instance, the Gleevec in the morning, to take it at night. Because if you do become fatigued, it's just a matter of after you take it with your meal, just you go ahead and relax and go to sleep, and it just kind of wakes up on a better note. So I wanted just to make those two suggestions.